All right. Thank you for the invitation. I'm thrilled to be here. Very much looking forward to the conference and the interactions we'll have. This afternoon I'm going to talk about network models for the diffusion of innovations and provide some examples of empirical work that we've done to test out various models and ideas of social influence. And as well as I'll close briefly with a discussion about the implications for interventions. I think I'm going to have to hold this in order to move around. So just a quick acknowledgement. Most of my research is funded by the National Institutes of Health, and these are the relevant grant programs that I have underway at this present time. So diffusion of innovations is a field that's been around for a long time. There were studies of diffusion of postage stamps and arrow flints and all kinds of different artifacts going back to the early 1900s. About 1943, a publication was printed by a journal called Rural Sociology on the diffusion of farming practices by Bryce Ryan and Harold Gross. And this publication was a landmark publication in setting forth the paradigm for the diffusion model. And in their publication, they noted that there were many people who adopted, or few people who adopted the innovation early when it was first introduced. Then the adoption accelerated rather rapidly and then tapered off as there were fewer non-adopters left in the population. They interviewed 259 farmers in Iowa about their adoption of hybrid seed corn, and subsequently there were hundreds of studies done on the diffusion and adoption of hybrid seed corn as well as other farming innovations, pesticides, herbicides, and so on. And Ryan and Gross found this S-shaped curve very notable and saw the pattern in it and compared two different kinds of variables in the adoption of innovations. Those focused on economic factors, those focused on social factors. Bryce Ryan had a PhD in joint economics and sociology, and so was interested in comparing those two different classes of variables. One of the things that Bryce Ryan discovered, of course, was that social variables seemed to be more important in farmers' decisions to adopt. Now, the thing is, what Bryce Ryan did not do was able to capture the networks of how farmers were talking to one another. He had evidence that social influence was important, but he didn't know which farmers talked to exactly which other farmers, and so he couldn't model the way networks influence behaviors. And we know from a lot of research now that there are a number of things that happen in networks that influence the spread of ideas and practices. That is, awareness and information flows through them, detailed knowledge, technical information, and so on and so forth. Well, you can model the spread of innovations without networks by creating a simple spreadsheet just like this in Excel, in which you hypothetically assume there's a population of 100 people, and then assume that 5 of those people are going to adopt the new idea all on their own or from some external influence. Those 5 adopters interact with the 95 left that are non-adopters. They convince them at a rate of 1% to adopt, and as a consequence, you get 4.75 new adopters. So now you start with 9.75 adopters. They interact with the 90.25 left in the population, convince them at a rate of 1%, and then you get 8.8 adopters at the end of that time period. And you can follow that process through for 10 time periods, and you get a very nice S-shaped curve, just like Bryce Ryan had discovered, and just like many people have shown for many innovations. This is often called a random mixing model because we don't make any assumptions about the network effects that are occurring in the network. We just know that people are interacting with one another, and that might be random. Well, I sort of set out in the steps of Everett Rogers, who's somebody well known for studying diffusion of innovations, and tried to understand, well, how can we model the role of networks in the process of diffusion? And we develop a rather simple model. You have an individual, an ego, connected to some number of other alters. In this case, I have 6 alters, ego and alter, and if that person's ego network is filled with users, they're more likely to become an adopter themselves. Now, in contrast to that model of cohesive influence or direct influence, Ron Burt proposed a model of structural equivalence. And in that model, what Ron Burt said is people don't have to be directly connected to one another to be influenced by them. They may be influenced by people whom they're structurally equivalent to. So if I occupy the same position in the network space as somebody else, we can influence each other because we are aware but not necessarily communicating with one another about our adoption decisions. I set out to test these two contrasting models, cohesion versus structural equivalence, in existing data sets that had been around by 1990. Now, these are the only 3 data sets in which we have information on who's connected to whom, a network, and we also have information on an idea or practice that's been spreading through that network. We don't get this kind of data typically. We have a lot of network data, and sometimes we have lots of diffusion data, but we don't have both the network and the diffusion data at the same time. And this has been a major problem for a long time because our research is limited by it. These 3 data sets are available publicly now. They are from 3 different populations on 3 different continents in 3 different decades, but they have some interesting characteristics in that diffusion spread rather rapidly across all 3 populations, and it occurred over a long period of time, which is characteristic of diffusion. These are the diffusion curves for those 3 studies, the top one being the medical innovation data, the middle one, the Korean family planning, the Brazilian farmers data, and the middle one being the Korean family planning data, and then the red line being the Brazilian farmers data. For some reason, the legend didn't copy over. The Coleman, Katz, and Menzel data on medical innovation diffusion is one of the most well-known studies. And in this study, Coleman, Katz, and Menzel concluded that people who are connected large in their networks, those with 3 or more contacts in the network, adopted the innovation much more rapidly. It diffused much more rapidly among that group than those who are more isolated in the networks. So I took these 3 data sets, I calculated terms for whether or not you're exposed to the innovation by your direct ties or through structurally equivalent alters, created what's called an event history data set, put in a bunch of control variables, and discovered that in the Coleman, Katz, and Menzel data, we have no evidence for contagion. We have no evidence for a diffusion effect. In the Brazilian farmers data, we have evidence for a structural equivalence effect. In other words, farmers adopt when people in their same network position adopt, not when the people they're connected to adopts. And that makes more sense because the structural equivalence argument is one of competition, like firms. In the Korean family planning data, the coefficient for interpersonal communication is strong and in the right direction, but it didn't attain statistical significance. So we almost had very strong support in these classic data sets for the general diffusion model. One of the things that we discovered, of course, is that sometimes we don't have network effects because people have varying thresholds to adoption. In other words, some people are willing to do things before anybody else in their network will do them because they're innovative. Other people wait until everybody in their network does it before they're willing to do it. If we knew the exposure effect was always there and people only adopted when a majority of their network adopted, nothing would ever diffuse. Everybody would be sitting around waiting for somebody else to do it. So some people have to be innovative. Some people have to be willing to do things before anybody else in their network would do it. I'm not one of those persons, by the way. I wait until everybody else is doing it before I'm willing to do it. I'm just a very, very risk-averse person that way. But there are people like Dimitri who go off and do things before anybody else will do it, rush headlong into the fire and save the world. And thank God for people like Dimitri. This is just a graph of thresholds for the Korean family planning data, but I showed this graph to illustrate that there are people who are innovative. In other words, they're early adopters, but they're very late in their personal network. So they are not necessarily innovative, although traditionally they would be classified as innovative. Now, that's somebody like number 11 or 35. They're very early, but they wait until everybody else in their network does it before they're willing to do it. You also have people like 64 and 49 who are very late adopters, but they're only late because of where they are in the network. They don't receive information about the innovation until very late. And so, as a consequence, they adopt later. So after I finished my dissertation back in 1991, the first thing I realized I needed to do was to get new data on adoption and networks. And so I set out to replicate the Coleman, Katz, and Menzel data from the 1950s. And it only took me 20 years to get these data. So I'm telling you, if you just have a little bit of persistence, it'll happen. We worked with a pharmaceutical marketing company, and as a consequence, we were able to obtain data on exactly when physicians prescribed a new drug that was coming out on the market. And we interviewed, I worked with colleagues at the Wharton School of Business at the University of Pennsylvania to do this. We interviewed physicians in 3 different cities about their networks, whom they're connected to, who they refer patients to, and so on. And here is a graph of one of the networks from the city of San Francisco. What you can see from this network, of course, is that there's homophily in the network. Now, those of you that were taking workshops today and have some understanding of networks know that homophily is very important. We collected these data and we saw automatically that physicians who had European surnames were connected to one another, whereas other physicians who had Asian surnames were connected to one another. So the physician network was strongly homophilous, right? They're much more likely to be connected to other physicians of their same ethnicity. Homophily is a very important principle in networks. The other thing that you see, of course, is that there are some physicians that are very prominent in this network, right? They are opinion leaders. They are the physicians that many other physicians turn to for advice, and they're the ones that are going to influence the diffusion and uptake of this new drug in this network. Finally, the third thing that you see, and the number is 175, although you might not be able to see it there's one physician who is a very important opinion leader in the Asian American community, not in the European one, and this is a physician that the pharmaceutical marketing company had completely missed with all of their detailing efforts and all of their marketing efforts. So immediately, the pharmaceutical marketing company turns its attention to this person and tried to then start to accelerate the uptake of this new product in this network. And sure enough, the new behavior spread rather rapidly in this network. I know you can't see these numbers. I didn't expect you to, but it's to remind me to tell you that we did a lot of fancy-dancy statistical analyses to show that the network was influential in these physicians' decisions to adopt this new drug. So after sort of trying to uncover the notion of cohesion versus structural equivalence and these basic network effects, one of the studies that I did was to do an analysis of influences on smoking among adolescents in American schools. And in this study, we calculated whether or not a student had smoking friends, and we discovered, yes, if a student has smoking friends, he or she's more likely to become a smoker. We also discovered that if a student was popular, if they received a lot of network nominations, high degree centrality, they also were more likely to become a smoker. But what was very interesting is that we discovered that students who received a lot of nominations and were very popular were more likely to become smokers in schools where smoking prevalence was high and less likely to become smokers when smoking prevalence was low. So there's an interaction between the network effects and the network position and the norms and the prevalence of the behavior in the community. And so now we're starting to get beyond simple network effects, but understanding them within the context of what's normative in the community and the prevalence of the behaviors in the community. So there's going to be complex interactions between the network measures and terms that you learn and the cultural, social, and behavioral factors that are occurring within the communities that you're studying. So we have exposure effects. And actually, as an academic, we can create rather complicated exposure terms, right? There's no reason for us to have a very simple model of how you're connected to people and that being influences you. We can look at all kinds of different network exposures and how they influence people. We can look at online behaviors, right? So C might be more influenced, ego might be more influenced by C if they're connected online or less. We also know that tie strength matters, right? E is more strongly connected to A than B. So A's behavior is going to have a stronger influence on ego than B's behavior. We also know that A and B are more likely to influence ego if A and B are connected to one another, right? E and D are not connected to one another, so their influence on ego will be less than the influence that A and B have on ego. And we also know, for example, that certain attributes might make a difference. So F may have an attribute, may be beautiful, may be tall, may be gregarious, and that attribute will increase the amount of influence that F can have on ego. We also know that indirect effects may occur, right? So G, H, and I can influence ego through C. So there's 2 steps and perhaps 3 steps out that indirect influence can occur. And we don't know whether or not the intermediary person has to engage in the behavior or not for those indirect effects to occur. There's a debate in our field right now as to how many steps out that effect can occur. I believe it doesn't go by more than 2 steps. Other scholars believe it goes out to 3 steps. And so we're still trying to work that out. We also know that joint participation in events can influence individuals. So for adolescents, we have been able to get data on whether or not they play on a sports team together. And students who are friends and also play on a sports team are more likely to influence one another than those who are friends but don't play on the same sports team. Right? So A and B have stronger influences on ego than D and C. And this extends to organizations, agencies, adult populations, all different kinds of populations that we'd be interested in. We've also discovered something called selection is a mechanism for bringing about homophily in networks. Selection is the process by which individuals make network changes in order for the network to be consistent with its behavior rather than changing their behavior. So in this case, for example, A and B engage in different behaviors than ego, C, and D, and so A and B make a choice to be connected to one another, and ego makes choices to sever the ties to reduce, get rid of the links between ego and A and B. So in the process of doing all of these different kinds of social influence tests and so on, one of the things I started to get interested in was being able to measure not only the diffusion of innovations within a network, but to measure multiple networks and changing dynamic networks and changing dynamic behaviors over time. So we have managed to get some data on a policy innovation called the Framework Convention for Tobacco Control. The Framework Convention for Tobacco Control stipulates many of the things that we now regard as normal and routine for tobacco control policies in a country, right? Restrictions on smoking indoors, in workplaces, on marketing, and adding warning labels. The Framework Convention for Tobacco Control, the FCTC, was introduced by the World Health Organization in 2003, and over the next 10 years, approximately 85% of countries have ratified the FCTC. The United States, unfortunately, has not ratified the FCTC and continues to be a laggard or a very poor international player with regards to the FCTC and other UN treaties. In our earlier analysis, we discovered that countries who are connected to other countries via an online forum called GlobalLink were more likely to ratify the FCTC at the same time. We drew network diagrams of these connections of the earliest adopters and the non-adopters, and you can very see from a visual explanation that those networks are quite different, right? People that are connected up in the network much more likely to adopt that treaty earlier. In fact, we also have 2 other treaties, one on corruption and one on pollution, that have also diffused through the international community over these past 10 years. And we know exactly when. We know the exact month that every country ratified these different treaties. I can't do that. So we're specifying a statistical model, which is an event history model that looks at whether or not ratification of each one of these treaties is a function of the ratification of the other countries that a person is connected to through a variety of different networks. And here are the data. In this analysis, we include lots of country attributes, which may be important to the timing of country ratification. And as you see, I have 13 different networks that I've been able to build into the model to determine whether or not ratification by a country you're connected to in any one of those networks influences a country's decision to adopt that treaty. My goal here is to show that networks that are relevant to one topic influence adoption of that topic, and networks that are relevant to a different topic are influential on that topic. I can't conduct an experiment with the whole global community, randomizing it to conditions. But what I can do is take different topics and different networks and show how they correspond to one another. And what we've discovered is if we look at the Global Link Interest Group Co-Membership Network, it shows you that countries who are connected via Global Link, a tobacco control online network forum, were more likely to influence one another in their ratification of the FCTC. But if you look down below, the Pollution COP, Conference of the Parties Network, is associated with ratification of the Pollution Treaty, and participation in the Corruption Network is associated with ratification in the Corruption Treaty. So across these different networks, if countries are connected via a particular network, they're more likely to ratify that treaty after the countries that they're connected to ratify that treaty. So if I'm exposed via a network to other countries that are doing something, I'm more likely to do it in the subsequent time period. So now I've gone from looking at one behavior in one network to multiple behaviors in multiple networks. The other thing we can do with this kind of modeling is measure two things called infectiousness and susceptibility. Because I have data at the micro level and I know exactly which countries are connected to which other countries, I can determine whether or not once a country ratifies a treaty, if the countries they're connected to then ratify the treaty in the subsequent time period. And I can also determine by measuring susceptibility whether or not a country is more likely to ratify after the countries they're connected to ratify. And you can do this with any diffusion network data set. So you can calculate how infectious people are in an organization when you're trying to spread a new behavior, or how susceptible they are to a new behavior as it spreads through the network. So if networks are very important, and we think networks are very important for changing individual, organizational, and community behaviors, then we can use that information to create interventions that would accelerate the diffusion of new behaviors and create better performing organizations and communities. And so I've developed a field called network interventions where we use network data to purposefully try to accelerate behavior change in networks. And last year, 2 years ago now, in 2012, we published a paper called Network Interventions in Science. And in that paper, I outlined 3 principles for the design of network interventions. One is that your program goals matter, right? So what I'm trying to do with the network will influence in part my ability to make a network intervention. If I want to accelerate behavior change in the network, that suggests one kind of network intervention. But if I want to slow down change or fragment the network, that suggests another type of intervention. 2, that we need to develop good health behavior and other kinds of models to explain how individuals, organizations, and agencies change and operate. Good theory about what drives behavior, good theory about what prevents behavior is critically important to designing good network interventions. And finally, that we have the opportunity when creating network interventions to learn from our communities as well as to try to induce change on them. So the network provides an opportunity for you to learn what's important to your community, right? As a dean, if you know the network of all of your faculty, it will enable you to work better with your faculty to bring about change and understand what's important to them. So this table describes the many different kinds of network interventions that are available. And these interventions range from individual strategies where you identify peer opinion leaders in networks and use them to accelerate behavior change, or you identify bridging individuals or marginal individuals or other kinds of individuals. We also have segmentation strategies in which you find groups in networks and use those groups to bring them all in at one time to create a behavior change opportunity. And induction techniques, where you try to activate the network, get them to spread via word of mouth the new idea or practice, to try to get the idea to snowball or go viral in the network. And then finally, alteration strategies. In alteration strategies, we very specifically change the network. We can add nodes to it or delete nodes. We can add links in specific ways or delete links, or completely rewire the network based on some kind of particular property. So there are lots of different choices there. Now, in this article, what I do is outline all of these different strategic, tactical, and operational choices that you have for designing a network intervention. And I don't have the time, of course, to go over all of these different options in detail, but what I can show you is this picture, which graphically displays what all of these different kinds of network intervention choices are and what they look like. And I leave a question mark in this table to highlight that this obviously is not an exhaustive list, that as we develop our science of network interventions, we will undoubtedly come up with new alternatives and choices. And just to mention, I wrote an R program which does all of these calculations. For anyone interested in doing network interventions, that R program is freely available that people can run in order to implement them. And finally, I just have a couple more slides. One is on selecting a network intervention, and there are different principles that might influence how you decide on which kind of network intervention that you want to do, what kind of network data you have available, or the existing network structure. In some cases, there's no network at all, and your first network intervention is to build a network. And the second is the behavioral characteristics of the domain where you're working. So, for example, as I mentioned, the existing prevalence of the behavior could make a big difference. Its perceived attributes and so on and whatnot could make a difference. And then finally, as I mentioned earlier, I think behavior change theory and social theory is a very important thing to know and understand. And in fact, if we know what kinds of mechanisms, what kinds of theoretical mechanisms motivate behavior and action in a network, then we can link that mechanism to the choice of specific network intervention choices. And here's just a list. Obviously, we don't have time to go over in detail what each one of these mechanisms are and why they suggest this kind of network intervention, but that work it's in press and it'll be coming out pretty soon. So finally, I just want to conclude by saying there are a lot of different ways that we know that networks influence behavior. There are different models for the diffusion of innovations, and we've got empirical evidence that supports many of these different mechanisms. And it's quite a large array, actually, much, much larger than the notion that something simply spreads through a network. Well, how it spreads and all of the different ways that individuals in that network influence one another is actually quite complex. There are a lot of different explanations for what's going on here, and surprisingly, we're still understanding and learning about this. We know from a lot of empirical work that these networks do influence the timing of behavioral decisions, and because of that, it really suggests ways that we can use network data to accelerate behavior change or bring about community or organizational change in a more efficient, I think, and in a more profound and theoretical way. Thank you. Did you want to?
Yep. Yeah, thank you a lot, Tom. And we have some 5 minutes for questions. Please.
Anyone?
Thank you for this interesting talk.
I was wondering, when you analyzed these, the participation in this global networks and the outcome of this, and whether or not you have accounted for the fact that maybe states only interact in these networks because they're already interested in signing these corruption or anti-tobacco treaties.
Right.
So
No, that's a very good point. And with the global link data on the tobacco control, that network actually started in 1992 and existed continuously up until the end of 2013. So it was around for 21 years. And so there would be a lot of participation in it over the course of the time interval. But because of the way we do the analysis by the event history framework, we control for all those prior conditions in the statistical analysis. But I think it's a point well worth understanding. And in fact, what you see, of course, is that the United States is the most active country on Global Link and yet doesn't ratify the treaty. So it's a case in there that shows you, well, it's part of the process, but it's not being influenced by the network, and it's not influencing other states either, even though there's so many people in the United States participating in this global tobacco control effort. So, but I think it's a really good observation, and I think always with networks, there is the danger that participation in the network actually signals some interest in what the behavior is.
Okay, anyone else? Yep.
Okay, thank you for your... well, I get very excited about your presentation, especially, of course, about the options that you sketch of network interventions. And then there is this little voice in the back of my head saying, but he was also talking about this selection mechanism. So networks change over time, probably. And I was wondering, I mean, if we have a very static network, I can imagine that you can use this structure to intervene. But how about networks that are changing themselves? And aren't we going into, well, is network volatility increasing over time? So is the problem getting worse?
That's a really good question. I think when it comes to many of the interventions we've done with identifying opinion leaders, we've discovered that in the studies, we've done over 20 randomized controlled trials now, not only me, but lots of people. Those networks tend to be very stable. Physician networks, hospital networks, and so on, relatively stable, and identifying those peer opinion leaders is not particularly difficult. However, when it comes to strategies such as alteration, I think that would be very, very difficult to do. Networks are the way they are for a lot of good reasons, and many people argue that when you measure a network, you measure it at its optimum structure because that has organized itself that way, and that you can't make network changes. And the only way that network changes come about are when people make selection choices that maximize their own individual utility. So I think it's going to be a lot easier to do interventions where we identify opinion leaders and don't require a lot of knowledge about the network structure than interventions in which we're trying to alter the network and we require a lot of information on what that structure looked like and require it to be somewhat static. Now, the second part of your question is network volatility increasing? That is a really good question, and I think that is a question that is answered by it depends on the level or scale that you measure the network, right? So the network in my academic department is not changing very much at all. I have the same colleagues I've always had. I like some of them. The ones I don't like, I still don't like. But other networks, adolescent networks, for example, are oftentimes in a rather rapid state of flux for some people. For other people, they stay stable throughout. So I think this is an empirical question to be answered. I don't think there's as much network change as we like to think there is, and I think that's in part because homophily is a strong principle, transitivity is a strong principle, and there are some people, like Wouter, that are more popular than others, and they'll stay popular, right? Dimitri.
No. So, what I wanted to ask you, and but I have to say that I'm impressed that this is 2 a.m. for you.
Yes. Yes.
I'm just fascinated. Anyhow, what I wanted to ask you was, could you expand a little bit on your argument on the influence at 2 versus the Fowler and Christakis 3-level?
Yeah, right.
Could you expand a little bit on that?
Sure, because my philosophy is that actually I think most of the effects of networks come with the direct ties that you're strongly connected to. The 2 or 3 closest people you're connected to are the ones that influence your behavior and not many other people beyond that. And I think only for, let's say, low involvement types of decisions would indirect ties matter, okay? Now, I don't think that indirect influence goes out more than 2 steps. I can well imagine that I might be slightly influenced by the friends of my friends. I don't think I could even be aware of, let alone be influenced by the behavior of my friend's friend's friend. Now, Christakis and Fowler have demonstrated that they see that effect out 3 steps. But I would argue that they see it because their data are incomplete. There's a lot of missing links in their data that would actually reduce the distance of those chains. Because their networks are very spindly, yeah. But I think that's the core of the debate. Yes, we got to move on.
Thank you, Tom. Yeah, we have to move on because we're
Good. Thank you very much.
behind. And thank you a lot for this very interesting talk.